I like to talk about what's happening. A lot of the confusing things going back and forth on the news channels, and they happen so quickly. I like to discuss them and break them down and let everybody know what's going on as it relates to our community. So please like and subscribe and follow the channel. Love to have you in the conversation. Comments are always encouraged, and you don't have to agree with my vantage point. So anyway, let's get into it. Today we're going to be talking about not just COVID-19, but the preparedness of the United States when COVID-19 came about. A lot of things were going on when we were trying to prepare, make sure the hospitals were prepared, trying to make sure testing was prepared. There are very key people, influential people involved in making sure that things happen around the United States to protect the country. That's their position, that's their job. Also, these people are very important when it comes down to medications and what should be tried in the hospitals and some of the research as well. But what's been happening here recently is one of the top doctors or top scientists in the country has basically been put on trial because he was ousted from his position for contradicting some of the things that were being said in the public eye from the White House and the Trump administration. So he was kicked out of his position, and he was brought in to explain. They wanted to ask him some questions. So I'm going to play you some clips here so you can see what he's been saying about the Trump administration, about information and how it's being passed to all the Americans around the country.
We are facing a highly transmissible and deadly virus which not only claims lives but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear, stemming from a lack of a coordinated response and a dearth of accurate, clear communication about the path forward. Americans yearn to get back to work, to open their businesses and to provide for their families. I get that. However, what we do must be done carefully with guidance from the best scientific minds. Our window of opportunity is closing. If we fail to improve our response now based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution. We must listen. Each of us can and must do our part now. On Tuesday, Dr. Fauci delivered a message in a voice that is clear and trustworthy, as he encouraged us to act with caution as we return to our daily lives. We should listen to him and other scientists sharing their expertise. While waiting for a cure and a vaccine, which I believe will come, there are things we must do immediately. We must increase the public education about the basics: washing hands, social distancing, appropriate face covering. They're simple but critical steps that buy valuable time until there's vaccine. We need to ramp up production of essential equipment and supplies, including raw materials and critical components. Shortages of these increase the risk of our frontline healthcare workers. They deserve the best equipment to protect themselves. We need to facilitate equitable distribution of essential equipment and supplies. And finally, we need a national testing strategy. The virus is here. It's everywhere. We need to be able to find it, isolate it, and stop it. We need to have the right testing for everyone who needs it. We need to be able to trace contacts, isolate, quarantine, and appropriately while striving to develop a cure. Initially, our nation was not as prepared as we should have been, as we could have been. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership. be plenty of time to look back to assess what has happened, so we can improve. But right now, we need to focus on getting things right going forward. We need a comprehensive plan that everyone knows and everyone participates in. Congress has taken important steps to support the response, and there's much more we can do. With your help, we can get through this crisis. Working cooperatively with our global partners, we can and will succeed in finding a cure for COVID-19. But that success depends on what we do today. We will either be remembered for what we did or for what we failed to do to address this crisis. I call on all of us to act, to ensure the health, safety, and prosperity of all Americans. You can count on me to do my part.
I felt that statement was very clear. That statement was very clear. What we're seeing around the world is that all of these countries are fighting for their lives right now. Everybody is cooperating with the government. The government's cooperating with the medical facilities and everyone else because they're trying to protect lives. I feel, unfortunately, that's not happening in the United States. I don't know why. I don't know why it's not working as well as it should. But some things are obviously wrong. Some things that's got to be made right. I feel like people are not getting the information. They're not understanding. And I feel like it's not transmitting from the top down the way it needs to. I heard a statement earlier today. One of the physicians was talking about the masks, the N95 masks, and where they came from. And some of them were only 30% effective. They weren't tested to see if these masks were protecting the nurses and doctors in the hospitals the way that they should. Because of that, hospitals were getting defective materials. That should never happen. In the United States of America, that should never happen. We have equipment. Probably not enough equipment, and we still could ramp it up. Also, the tests aren't happening, not the way that they need to in the United States. I'm in Asia right now, and I see, and I'm experiencing, that testing is going on everywhere. They're isolating and they're tracking people. Meaning, if I go out to a club or a party or a big event or something like that, meaning before things were closed down, because most everything's closed now, they were able to track where my travels took me and who I was around, so that they could say, okay, there's a possibility that you came in contact with these people. Now we can contact these people and let them know that they need to be tested. They might need to be isolated if you were there for a particular amount of time. We need to know who has the disease and who's spreading it continuously. That's not happening in America. I feel like the government is dropping the ball on that. Not everybody would agree with me on that, but I see it. This is from my perspective, and this is what I see. I'd love to hear what you think. I wanted to play another clip for you today.
Dr. Bright is up there testifying today. Everything he's complaining about was achieved.
We've had tremendous response to the hydroxy. We've had the great response to zinc along with it and the GPAC. So a lot of people have sworn by it. And we'll see. I don't know him. I never met him. I don't want to meet him. But I watched him, and he looked like an angry, disgruntled employee who, frankly, according to some people, didn't do a very good job.
Which brings me to another question. Why are we listening to Donald Trump when it comes down to scientific and medical information? Donald Trump's not a scientist, and he's not a medical person. He doesn't know what goes on inside of hospitals. He doesn't know what goes on inside of research facilities other than what he's been told. Why are we listening to him? This is the same man a couple of weeks ago who said that people should try injecting themselves with bleach or great amounts of light, and that would cure them or something. These kinds of things, they don't need to come from the president. We're a nation of scientists and medical people. We have people for that. Why is Donald Trump always in the forefront trying to teach people things that he doesn't know about himself? And this is not to say that Donald Trump is not smart in certain areas. Maybe he's smart in business. Maybe he's sharp in accounting. Maybe he's good in construction. But that's not the same thing as medical knowledge, research knowledge. These people have gone to school many, many years and have been working in these areas all of their life, all of their adult lives. And they've grown in their credibility. They know what it is they're supposed to be doing. The problem with America right now is we have a leader where everybody's walking on eggshells and they have to agree with what he says. When did that happen? In the Obama years, we didn't agree with everything President Obama said. We followed him. We followed his advice on things that we thought would work. And things that didn't work, we didn't follow that. When President Bush was the president, we didn't follow his advice on everything he said. If he said something that didn't make sense, we fought him on it. We challenged him on it. If he said something that made sense, we rolled with it. That's the way America's made. So I want to encourage all of you to stop listening to things that are coming from the president that doesn't make sense without challenging it. We are a nation of people. We're bright people. We can think for ourselves. We don't need Donald Trump telling us medical things when he doesn't know what he's talking about. And I'm okay with saying that Donald Trump doesn't know what he's talking about. And I want you to be okay with saying he doesn't know what he's talking about. When it doesn't sound sensical, you can challenge them on that. But the problem is, like I said earlier today, right now, we're faced with a crisis that is going to either be prolonged or it's going to be shortened. People are losing their lives. At least 84,000 people in the United States have lost their lives so far, and 250,000 around the world. It's very, very important that we start listening to the professionals who are telling us the right things to do. Now, this man was taken, Dr. Bright, this man was fired from his job or ousted from his position because Donald Trump and others didn't like what he was saying. Same thing for Dr. Fauci. Dr. Fauci and some of the others have been ousted from their positions, okay, or kept off television because they don't say the things that the president wants them to say. Because the president wants them to say, let's open up the schools, let's open up the businesses, and let's do all of these things. But for medical people, that doesn't make sense because we're faced with a pandemic right now. A pandemic means that all of these people are going to go to work, go to school, get sick, bring the sickness back home to them. More are going to get sick. So anyway, that's the discussion for today. I want you to think on these things. Let me know what you think about it. Like and subscribe to the channel, and let's continue to get into the discussion and see where this takes us next. Have a great day.